Sandy is a principal in the Phoenix office of REDW, LLC, one of the most respected CPA and consulting firms in the Southwest, with a strong focus on serving the needs of the healthcare industry. Sandy has more than 20 years of successful public accounting experience, specializing in the financial needs of privately held businesses, including accounting, tax planning, and business consulting. She's been a delegate to the White House Conference on Small Business and has testified before Congress about the impacts of tax legislation.
My goal today is to take hundreds of pages of tax legislation and condense it into a 15-minute briefing. That's my goal. I will caution you, please do not try this at home. And because this Affordable Care Act is a massive, massive tax reform, overreaching and touching all of us in some way and more than one. And the multi-billion-dollar question as I read through this legislation is, how are we going to pay for this? And the answer is tax increases. And how do tax increases come about? 3 ways. One, you will see the reduction or the elimination of deductions that we used to enjoy. So they just disregard expense deductions. That works. 2, you'll see increases in taxes and imposition of new types of taxes. And 3 is the excise tax or penalties. So I'm going to start with the good news. The good news is in 2010, small businesses enjoyed some tax credits and they're still available. The threshold, though, is in a small business you have to have less than 25 employees and your average annual wages must be less than $50,000. And you can secure a health insurance tax credit. Well, if you think about that, not many businesses will be eligible for that tax credit. But I do want you to know, because many of you work with nonprofits, is that opportunity is also available for nonprofits. Now you think, well, what good is that? Nonprofits don't pay income tax. Well, this credit can actually reduce their payroll tax. So any of you involved in charitable organizations that are small in size, this could be a great opportunity that they're just not aware of and not taking advantage of. That's the end of the good news. All right. The next thing you heard about in 2010 is we had a tax, a 10% tax on tanning services. Now, just so you know what entrepreneurs do is they said, okay, fine, we're not charging for tanning services anymore. We're going to have a towel fee. I think some actually tried to do that, so we'll see how that works out in audit. In 2013, this will hit you all individually. Medical expense, out-of-pocket medical expense, including health insurance that we pay on an after-tax basis, is deductible, reduced by 7.5% of your adjusted gross income. In 2013, that 7.5% threshold increases to 10%, unless you're age 65 by 2013 or older, and then you get a little buy. That's the elimination of deductions. But I encourage all of you to still keep track of your medical expense in Arizona, because Arizona allows you to deduct 100% of it. So it still helps a bit. Flexible spending account limits. There will be a limitation now, reduction in the amount that we can contribute on a pre-tax basis to flexible spending accounts. That amount now is $2,500. So again, reducing the amount of deductions or pre-tax exemptions that we previously enjoyed. And then here comes the fun part, all right? Medicare tax. We have 3 new thresholds with Medicare tax, new taxes. One is on medical devices. So you've heard about a 2.3% excise tax on the sale of any medical device. Now, what's a medical device? Not glasses, not contacts, not hearing aids, not things that are typically used in the consumer on a retail basis. That will be imposed on the medical professions, things that they use that are generally administered by a medical professional. And in reading some of the legislation, I know the dental community tried to lobby and say, but we should be exempt from that. And they were not successful on that. So it's generally administered by a professional, and that's just going to be a pass-through tax, much like sales tax. You'll see it noted, but it will definitely be passed through to consumers. Now, we have new Medicare tax in 2013, and I'm going to bifurcate it into 2 things. One is with wages. Those of you, those taxpayers that have, there's two thresholds. One, this threshold, and I want you to remember this, single, $200,000 modified adjusted gross income. Married joint, $250,000. Married filing separate, $125,000, so don't get any cute ideas, that won't work. If your wages and self-employed income is over $200,000 as an individual, you will enjoy an additional tax of 0.9% Medicare surtax. If you're an executive and your wages are over $200,000, you're hosed. There's not a whole lot you can do about it unless you want to go to your employer and voluntarily ask for a payroll reduction, which I'm certain that they would accommodate. One of the things you might look at is how is your auto expense. If you have an auto allowance is typically just put onto your W-2 as wages. So rather than have a completely taxable auto allowance, perhaps work with your employer to have an accountable reimbursement plan. A little more math, a little more paperwork, save a lot of taxes. It's good for both. So those are just some strategies that you can think of. I mean, just small things, but small things will matter as these taxes go up. If you're self-employed, you've got a lot of opportunity, and this is where we have a lot of fun with taxes with small business owners or even large business owners. So entity structure will matter. If you're an LLC, a limited liability company, you want to consider being an S corporation for tax purposes. If you're an LLC, currently, you want to look at who's the manager, who's managing this. That impacts whether it's subject to self-employment tax or not. So self-employment tax or self-employment earnings is subject to this 0.9%. If you're an S corporation, you want to evaluate, do I take more wages or do I let dividend distributions go through? Dividend distributions are free from this additional Medicare tax. Wages are not. Careful though, pigs get fat, hogs get slaughtered. You can't get crazy on this, it has to be reasonable. And that's always a rule of tax. And if you're a C corporation, consider an S election. It's not that simple. There's all kinds of other pros and cons with entity selection, but I'm just sharing with you there's always planning opportunities in tax law. Why S Corp? That's a definite strategy to limit the self-employment income. And then, this is like the really mean one. This is mean. For the first time ever in our tax history, there is now a Medicare surtax on unearned income. What does that mean? Now, technically in the code, it's being defined as net investment income. Code section 1411. I think it should have been code section 911. That would have been more appropriate. Because that 16-page handout, double size that I provided to you on the table, that's all about defining what is net investment income. You think it's easy, but when you start preparing tax returns, it's not at all. Net investment income in general includes interest income, dividend income, capital gains from the sale of stocks or securities or mutual funds or properties, passive income on rent and royalty. If you have rental properties, that passive income is subject to this additional 3.8% tax. Also, flow-through income from passive activities such as partnerships, and if you're passively involved in an S corporation, is considered net investment income. It's mean. Now, who does that impact? It impacts people over that threshold. So if your modified adjusted gross income, married joint, is under 250, you're okay. If it's over 250, then you will incur an additional 3.8% Medicare surtax on the greater of your net investment income or the amount over that $250,000 threshold. What's not included? Municipal bond income. Am I not? Okay, I'm still good. Okay, what's not included is municipal bond income. Why? Because tax legislation, and this is really important, it's not about fairness. And it doesn't make sense. So don't ever try to logic through a tax matter. Tax legislation is driven, seriously, I learned this, I got in trouble because I thought, well, that made sense. Well, it doesn't matter if it makes sense, this is the rule. So Tax legislation is driven by social and economic policy, and this Affordable Care Act is a perfect example of it. What Congress wants us to do, they provide incentives, as Tim referred to them, I call them penalties, to drive us. It's like a cattle prod. What they want us to do, they create tax legislation to take us in a certain direction. And that's really, really prevalent in this Affordable Care Act on many, many levels. They want us to go into an exchange. If you don't, then you're penalized. You know, they want us to do certain things. So you have choices, allegedly. So municipal bond income, state and local governments, they are not subject to this 3.8%. Do I encourage you to do that? That's completely your choice. You work with your financial advisor. That's my little non-disclosure. So what else do we have here? Oh, also veterans benefits are not subject to this 3.8%. And you see all this crazy stuff going around on the internet. My clients send it to me. Is it true? I go to fact or fiction. No, it's false. So gain on the sale of your residence, where does that fall into place? On the gain of a sale of a principal residence, married joint, you can exclude the first $500,000 of gain. That's not subject to this Medicare tax. If you're single, it's $250. If you have a gain on your principal residence above the $250, $500, one, you don't live in Arizona, and two, you will be subject to that additional 3.8% on the amount over that amount excluded. So don't worry about that. That whole thing going around the internet is just really disturbing. Now, I'm just going to throw this out because this is really cool. Congress likes to call them loopholes. I never call them loopholes. Everything Congress does in tax legislation is intended. For us, they are opportunities, okay? Not loopholes, just another word, but I like it better. So if you're in real estate in a material way, this is like a huge opportunity, is to classify yourself as a real estate professional. Because if you're a real estate professional, you're not subject to the passive of 3.8 or the active of 0.9. It's this cool little silo that you get to put yourself in, and we'll see how long before Congress decides this opportunity isn't allowed anymore. But for right now, it's there. So I do a lot of real estate work, and we're preparing our clients in 2012 to qualify under this provision, so they just drop right in the middle and they don't be subject to any of this. So that's a happy thing. Above all, though, you know, you could do things like additional contributions to retirement plans to keep your income under that threshold of 200, 250 and such. You can look at deferred annuities, but I always tell you, please do not let the tax tail wag the dog. Everything you do in your financial life has to make economic sense first and foremost. If you can derive a tax benefit as well, that's excellent. But don't let the tax tail wag the dog. We saw that in the early 80s and late 70s with tax partnerships, and people just got in big trouble. So, and frankly, I will go on the record, I will say that medical professionals are among the worst of making investment decisions based on the tax results and completely ignoring the economics. And I see that a lot. I see that way more than we should. All right, so a couple more things, and then I'll finish up here for questions so we get you out on time. Individual requirement to have insurance in year 2014. What happens if you don't? If you don't in 2014, you pay a penalty, which is moderate at first, $285 for a family, or 1% of family income, whichever is greater. But by 2016, they're getting way more serious, and that amount increases to $2,085 for a family, or 2.5% of your income, whichever is greater. Okay, that's the cattle prod. For businesses with over 50 full-time equivalent employees. Now, what's 50 full-time equivalent? Okay, for any of you in that parameter, it's amazing. Tax research has been drilled down to Google. I kid you not. If you Google IRS Notice 2012-58, they will have all the guidance you need on what constitutes a full-time equivalent. And I would challenge you that if you're a small business and you're on the verge of going over that 50, don't do it. This is like the Small Business Reduction Act, because you either need to be really large or stay under that 50, because going over that little cliff, if you will, is extremely costly. So what happens? What happens is, if you're over that 50 full-time equivalent, then you must offer what they call affordable minimum essential coverage. Yes, there's all kinds of definitive criteria that tells us what that means. But if you do not, then the penalty imposed on a small business is $2,000 to $3,000 per employee per year over 30. All right, the first 30 they give you free. So if you have 55 employees and you do not meet this affordable minimal essential coverage, you will incur a cost of $50,000 to $75,000 a year, and that's a penalty. What does that mean? It's not deductible. So that didn't cost you just $50,000 to $75,000. It cost you more like $75,000 to $100,000. Big cattle prod. That's like a cattle. That's a branding iron. It's not even a prod. So that just gives you a little idea. I know that we're really tight on time as to what some of the tax considerations are. There are opportunities. There's always opportunities. The really important thing as you go forward in your tax life is to keep your income more level, to plan for these bumps so that you don't spike up and hit these additional excise taxes and then you're down this next year and you're under it. It's like, be efficient with your tax brackets, plan your income, work with your advisors. There's always something that everybody can do in order to help manage their income tax. Taxes is one of the most expensive things in our budget today. I mean, I think, you know, and going forward as we age, and yes, I'm a boomer, I like being a boomer. As we age, what are we going to spend most of our money on? Healthcare and taxes. So that's why we're all here today.